Well, the housing crisis continues in this country, and there is new research that shows that the foreclosure crisis especially could be making Americans sick. Mitra Kalita is joining me on set to talk about it. She's from the Wall Street Journal. And Mitra, you know, a lot of people obviously feel this crisis going on, but you're talking about people physically actually getting sick to the point where they're going to the hospital. What is going on that this housing crisis is adversely affecting our health?
So basically, two economists took data from the highest foreclosure rates of communities, and they married that to those same communities' ER visits and hospitalizations. And they saw a direct relationship between a surge in visits for hypertension, diabetes, suicide attempts, kind of stress-related ailments in these communities that they've concluded are not just a coincidence, that they really are going hand in hand.
And is it just people who are actually going through the foreclosure crisis, or perhaps are behind on the mortgages themselves, or is it their surrounding neighbors and communities that say, you know, we've heard about these tracts of communities that have 6, 7 homes that are in foreclosure?
I think it's a little bit of both, because you certainly have the people who are going through foreclosure who, you know, maybe they even had a medical crisis before that might have been responsible for sending them into foreclosure, and that's being exacerbated by the entire process. So you have some of that. But their neighbors, I mean, anybody who's underwater right now can tell you the anxiety that they feel as they look at their monthly mortgage bill and then look at, you know, their falling property values, and the two are not really adding up. So I think you're sensing, you know, a lot of people put a lot of money into their biggest asset, or maybe they didn't put a lot of money down, and that's a part of the problem, and are now feeling the health effects of that. And the interesting thing is that a lot of the people who are showing up at hospitals are under the age of 49. So it's like 20 through 49 is where they're seeing the biggest surges. So it's that same first-time homebuyer group, people who, you know,
you're starting families.
Exactly.
You know,
right.
they don't
so
have maybe as big a nest egg as some of.
Who are also contending with high unemployment and some of the other issues that are sending families into foreclosure.
Well, and I was going to ask you about that, because it seems from reading your article that it's such a multi-layered problem, because a lot of the housing crisis problems are caused by the fact that we have such high unemployment. So many millions of Americans have lost their jobs, and in conjunction with that, a lot of times lose their health care. So are a lot of these people, perhaps those who've lost their health care, maybe they're just not going to their doctor on the early stages of some of this, that waiting till it gets to be a full-blown exacerbated issue where they end up in the ER?
So that's a very good point. The same communities that are grappling with high rates of foreclosure are also those that might not have, you know, might be underinsured or uninsured. But the economists accounted for that with various controls, and they still saw a surge. So what you are seeing is a population that might not be getting the preventive care that they need. Again, these being stress-related ailments, they might get to a point where you kind of, you know, reach a certain point and the ER is your only recourse. And so, you know, the next steps here would be a public health issue. What do
I was going to say, well, what are the long-term effects of this? Because as we just heard from Kathleen, and we look at the consumer confidence numbers, I mean, we may be in this for a while.
Yeah, I mean, the consumer confidence numbers were like the lowest they've been in 2 years today. Housing data is also painting a very mixed picture of the economy. So the fact that we seem to be in this for the long haul, you can talk to anyone who's in foreclosure right now, and they can give you a long list of ways that their banks can make their lives easier. I don't know if we're going to see that impacting their health, but hospitals, I've talked to a number of hospitals around the country that say that the ERs are starting to, you know, maybe they were more equipped for broken arms and other such trauma, and now they're kind of having to shift to more of like psychological treatment and the areas that, again, these types of communities are seeing certain conditions.
All right, Mitra, thank you so much for joining us on
Thanks,
such a sad topic. Unfortunately, so many Americans are dealing with this, but it's an interesting correlation between the housing crisis and our health, so appreciate it.
Thanks.